Marcy. I'm the patient coordinator here at Feldmar Plastic Surgery, and I have Dr. David Feldmar and Dr. Jean Lee with me. Today we're going to speak about why it's so important to book a consultation and what questions you should ask to make the best decision to choose which provider to go with. What do you think is one of the most common questions that a patient will ask you during a consult?
The most common question that patients ask me during the consult, I would have to say, probably the most basic question, am I a candidate for what I'm looking forward to doing? So, they always want to know, they have an idea in their mind of what they want to look like or what operations they want to get, but they also want to know if they're a candidate, which I also think is a very good question.
I am going to disagree with that. I think the most common question that people ask, especially in Beverly Hills, is how soon can I start working out?
Okay, change my answer. I totally agree. That is the most common question I get, is how soon I can work out after surgery.
Right, yeah.
How about you, Gene?
I agree with that too. I think, at least for me, I get a lot of times like, what can you offer me? What do I need? And then I tend to kind of flip that question around, and then I ask them, like, what bothers you the most? And I think for me, that's a good kind of conversation starter.
Yeah, I think we'll probably hit this point later, but the idea of, that is a very common question I see as well. A lot of times people just want to come in and have us, the doctors, tell them what they should get done, right?
Right.
And I think that that's probably not the greatest way to plan your future surgery.
Yeah, I agree with that.
Let's touch back to about working out. What are the rules with working out, and does it matter which surgery you're getting? For example, if you're just getting your eyes done or a simple earlobe repair versus getting a tummy tuck or a breast lift, is there a difference in working out? You want to start, Dr. Lee?
Sure. It does kind of go back to what operation these patients are going under. But then I think a rule of thumb is that about a month and a half, so 6 weeks until they can return to kind of their normal kind of activities of life, like going to the gym, going to the sauna, and so on and so forth. But it really depends on what operation they underwent. I think a good rule of thumb, anywhere from 4 to 6 weeks.
But again, we're in LA, so does a walk, an hour walk count as exercise? What counts as exercise? Because I cannot tell you how many times, like, well, what about a walk? What if I just do the Santa Monica stairs? What if I just go around the block? What's exercise?
Yeah, I think that comes down to try to getting an understanding of where your patient's coming from. I like to tell all my patients, and you know this, that I can't stop them from working out, but I agree. 6 weeks is a good goal to keep in mind for all surgeries because it just takes that long for the body to develop scars that are strong enough to hold our incisions together. However, light walking here and there I think is okay, and I think it really, I like to see my patients along the post-operative period because I like to see how they're healing and give them an idea maybe they could do a little bit more activity earlier than the 6 weeks. The other thing I like to just let them know, so they have that information, is that if you're going to exercise, you're going to get your heart rate up, you're going to get their blood flow up, you're going to move fluid into these areas that you had recent surgery, and it's just going to delay the healing. It's just going to delay the great results that we're looking for because you're going to get extra long swelling that's going to take more time to go away. And then again, you could potentially worsen our scars that we leave.
Now that you just touched on scars, there's a lot of Instagram and TikTok feeds saying that there's scarless surgeries or there won't be any scars with certain surgeries. Can we kind of debunk this and that you are paying for scars if you're removing skin?
Yeah, I mean, all surgical procedures typically involve some type of incision, and whenever you have an incision, you're going to get a scar. Yes, we are moving towards a more scarless type of surgeries in all aspects of plastic surgery, but it's a little bit of a misnomer. What we're really trying to do is minimize the scars, hide the scars, and use new surgical techniques that don't require a big incision, instead of a much smaller incision. And that may be using newer techniques like endoscopy, microsurgery, things like this that are going to limit how much scarring that we have. But really, if you're going to have surgery, I don't see a way to avoid scars completely.
Yeah, I agree with that. And I think you hit that on its head too. It's like, one of my pet peeves is when people come in talking about these scarless procedures. I mean, every time you go in to improve some kind of a form, you're gonna have to leave a scar someplace or somehow or another. It's just like, it's more, I think the correct question should be the quality of the scar and where the scar is gonna be. And that's kind of where finding the right plastic surgeon or a surgeon in general kind of comes into play. And I think we spend years in training kind of learning and really kind of finding ways to discreetly put these scars and meticulously trying to close these skin incisions in multiple kind of layers in order for the scar to be the most optimal once it's all healed in like 6 to 12 months. And so, and moreover, it's not just what happened in the operating room, but it's like the aftercare. So it's not just the stitches, but it's the aftercare, the follow-ups, the CO2, the microneedling, how we take care of it, yeah.
How your nutrition is going on. Are you out in the sun afterwards? Are you doing exercise like we talked about?
Yeah.
Are you smoking? I mean, there's a million different things that could worsen that scar. And then the opposite, are you doing things actively to make that scar better? Are you using silicone sheeting?
Right.
Or are you using silicone ointments? Are you using steroids when necessary? All of these things, you know, really all have to go together to make the best results possible.
Yeah.
And I love that both of you actually draw on the patient with a marking pen precisely where you are going to put the scars and the incision so they have an idea of where it's going to be. And I think that helps, makes them realize, oh, well, that's easy to hide, or, you know, I think it's better for them because they understand more once you actually draw on them. That's been my personal experience.
Right.
Another big question I think that we get is, do I need to lose weight before the surgery, and how much weight do I need to lose before the surgery? You want to start with this, Dr. Lee?
Sure. I think for any cosmetic surgery, any elective cosmetic surgery, you should be at your goal weight, is my opinion. I mean,
100%.
Yeah.
I mean, if you are in the process of losing weight, I always tell my patients it's better to delay the surgery,
Right.
wait till you get to your goal weight.
yeah.
If you're using medications to get to your goal weight, if you're exercising and dieting, whatever it is, try to get to that goal weight. I totally agree. And try to get to at a point where your weight is stable. It's not just like you drop down to your goal weight and next week you're going to bounce right back up. You know, you want to get to the point where you can maintain that weight to really get the best results.
Right. And one thing I want to add on to that is that even applies to people who want to get fat grafting too. I'm surprised at the amount of times I get asked by patients where, oh, I don't have enough fat, but should I gain weight in order for you to take out fat and inject it into my face? And I tell them that's not going to work out like that, because if you remove the fat from your abdomen and put it into your face and then lose that weight again,
you're just back to where you were.
You're back to where you were, and
that
it
all
makes
the time.
yeah. And I still get asked
I honestly
that.
think that stems from maybe over-aggressive surgeons that want to do cases.
I agree.
And they're looking for a way to be able to do the procedure, knowing that the long-term results really are not there.
Yeah, yeah, I agree.
Another question I think I get asked a lot, more so when I'm talking to all the patients afterwards in my office, what if I don't like the results?
Well, I think it's a more of a complicated question. You know, first try to figure out what is it that they don't like about the results. Was it because they just don't like the overall results of the aesthetic procedure, or was there something that didn't heal well, or maybe a part of the operation that didn't go as planned and you're getting something that you weren't expecting? I'm very critical of my work. When I see results that are up to my standards, I really want to do whatever I can for my patients to fix that problem, and keeping in mind, you know, the costs involved with this, and sometimes there may not be any costs involved with repairing that. I think it's a little bit more challenging when people get the results that are good results but they're not happy with. That could be a little bit more of a challenging situation, but I mean, I don't know about you, but I think that, you know, overall my main goal really is patient satisfaction, right? I mean, patient safety
100%.
and then patient satisfaction.
Yeah.
So I think at least at Feldmar Aesthetics and Feldmar Plastic Surgery, we're doing everything we can to try to make our patients satisfied by the time they're finished with this procedure.
And I think it's super important to also express that both of you tell the patients you can come in many times beforehand to have more discussions and have more and ask more questions. So I feel like when we do that, everyone has a realistic expectation of how this is going to go. Where, you know, I think it's super important that if we we have to be clear on what the expectations are, because if someone's getting a mommy makeover and they have all this extra skin because they lost, let's call it 100 pounds, they're realistic, you might have to go in, you might have dog ears, or you might have to go in and do a little tweaking because, again, safety is first.
Well, I think you hit on the most important point. The most important point is patient expectations and doctor expectations and what the doctor can deliver for the patient. If you guys are on the same page, the doctor and the patient are on the same page, patient satisfaction is way higher. It's when there's a miscommunication or a misunderstanding and expectations are not met. So yeah, I think it's very important in my practice, in your practice here at Feldmar Plastic Surgery. I think we're doing that a lot, is we really want our patients to feel like they could come in and ask questions, or something comes up. They're not like, your next appointment 6 months down the line. Come in, see us, talk about it, let's see what we could do to fix it.
I think it really all goes back to patient expectations, and like whether or not the patients and we are on that same page. And I think in order to strive for that, we offer multiple consultations for the same patients up until that point. And I mean, if we're not on the same page, then they may just not be the right candidate, so we don't offer them an operation. But
I think you just hit on something. They're interviewing us as much as we're interviewing them during a consultation.
Totally, yeah.
Is there a time where you will not take a case, and why? What would be the reason why you would turn down a case?
I actually feel like I turn down a high percentage of cases,
Yeah.
because what we do, a lot of people really don't understand what we can achieve as plastic surgeons and what realistic and appropriate goals are. Some people just come in with completely unrealistic expectations, or maybe requests that maybe verge on the unethical, and these things I usually will turn down or recommend that they see another plastic surgeon if that's what they're going for, or if it's just so far out of what is safe and appropriate for what they're asking for.
I agree with you. I mean, percentage-wise, I would say I turn down about 20 to 40%, and I say no.
I think it's at least 20%,
yeah.
for sure.
One, I think the main reason for that is that the patients are kind of misguided, and they may have gotten bad information, and they think they need a procedure, a specific one, and they come in and talk to me about it, and I don't think they're the right person for it. Or B, it's just a whole matter of kind of safety too. Or they have other things in their life going on if they're not at their goal weight, and so on and so forth. But, and hence the consultation. Consultation is very important.
And then you, Dr. Lee, just kind of touched on the subject of how do I know this procedure is right for me, and I think there's all different categories. I think if we start with facelifts, we have different ages. Women in their 30s come in, and then I think eldest was 80, 78. So especially with let's take the drastic number, 30-year-olds or 35-year-olds, how do we know that they're okay to do it, or how do we know that they're a candidate to do it, or if they should wait a little longer? And then on the other end of the spectrum, you have the 78 or 80-year-old that has never done anything, and she's 78 or 80. How do you answer that?
I don't like to get too focused on someone's numerical age. It really has to do more with their physical age, their mental age, their overall health status. So we see patients in their 30s that are aging faster than people in their 40s and 50s, and they have more skin laxity, or maybe they had some previous event in their life that resulted in reasons why they would be a good candidate for something like a facelift. In the last 10 years, last really 20 years that I've been practicing, the overall age range of healthy people is just getting older and older, and it's really quite remarkable. I mean, to see people in their late 70s and early 80s now that are the health equivalent of a 60-year-old is just amazing. So I don't look at the individual age, I look at the patient as a whole, and everyone's evaluated on their own.
I agree with that. Although I think a caveat to that is that, well, like the percentage of 30-year-olds that actually need a facelift is very, very slim. And I personally have not operated on a 30-year-old that needed a facelift. They probably just need a little skin tightening.
Yeah, I mean, we have so many different technologies and different things that we can do where before you get to, let's say, a facelift on a 30-year-old.
Right.
But there are, there's always an exception to every rule, and it does exist where people could benefit from that. Maybe not as much of a facelift, but sometimes a neck lift on younger people does give really nice results just because the genetics of everyone's different, and some people do age quicker than others.
I think a good thing about our practice, or one of the advantages, is that we not only offer procedures and surgeries between Dr. Feldmar and I, but we have a full-fledged kind of medi-spa that offers all types of lasers and peels and so on and so forth. So, I mean, we have the many tools in our toolbox, so to speak. And so age, I agree with that. It's as cliche as it sounds. It's really nothing more about a number, I think. I have come across like 40, 50-year-olds who are way too sick, who I would never operate on. And then I've personally operated on an 80-year-old who is probably as healthy as I am, and then we did her third-time facelift. So it's like, it all depends. You got to come in for a consult, and we'll talk, and we'll review your history and go from there.
Another myth I want to debunk that I think 50% of the patients that come in during a consult think, I get surgery, I'm done. And there's no maintenance, I don't need to do anything afterwards. Why am I paying all this money for surgery if I have to do work afterwards? And I think that's very lazy, in my personal opinion, response, because we're aging every day, and whether it's a mommy makeover, whether it's a weight loss surgery, whether it's a facelift, there's maintenance in every category. Do you want to touch on that, Dr. Feldmar, first?
I mean, I agree with your point. We do not stop aging, so we may be able to turn the clock back years, but the years keep ticking on after that surgery is over. And then to your second point, there are some times where you may be doing a surgery and one and done, but depending on what you're doing, let's just say a mommy makeover, someone with massive weight loss and they're looking to get skin removed, you may be able to do 70 or 80% of what needs to be done on that first surgery, but there's a lot of times, if you really want to get a certain goal, you have to look at it, it's a stepwise fashion. You may need 2 or 3 different procedures overall. It might take a year or so to get to that point. Each surgery is going to address an issue, and sometimes, depending on where you're starting from, you maybe have to do a second round of whatever that surgery is.
So why would you decide to stage surgeries? What would be the reason to stage surgeries in a mommy makeover or a weight loss?
Well, in those two examples, very common, let's just say someone with a lot of extra fat, okay, and they want to look a certain way or to be a certain type of thinness. We may be limited just on how much fat we could remove by liposuction alone on any one day, okay? So typically in the West Coast, we're looking at, on average, around 5 liters. So, some people may have 6 or 7 or 8 liters, so we may have to go back and remove more fat. We may need to remove skin, but we'll start removing the skin just on the abdomen and the flanks, and then come back and address the back, right? Or different parts of the back that might have extra skin. So it may take multiple operations. Just sometimes we're limited on how long what we're doing takes, and we don't want to keep you on the table for too many hours, so we may have to break up those operations. And then there's some operations that we can only do so much, let's say, skin removal, and in order to get a perfect result, we have to then go back and take out a little bit more skin once you heal. So sometimes there are multiple stages to some of these operations.
Yeah. If I can just add my 2 cents to that too. It's like, so here we spend a lot of time at the consult too, because we like to form that relationship with our patients. And it's almost like once we agree to do your operations, you're almost kind of our patient for life type of thing. And we want to see you back more often than not. And Dr. Feldmar, I've seen you kind of like see your patients almost every day. Like if they had any concern, we tell them to come in and we check them out. But it's like doing a really meticulous and well done operation is about 80% of that battle. It's like the other 20% is the continuous kind of aftercare, the maintenance aspect of it. Like if you were to buy a brand new car and you don't take it in for an oil change or car wash, I mean, it's gonna look like a crappy old lemon car in like 6 months. And the same goes to say like a facelift. Like we do a well-done facelift, but you need to routinely come in for routine Botox, skincare in order to kind of maximize and optimize that 10 to 12 to 15 years outcome.
Right. I mean, these operations are expensive, and you don't want to just feel like, oh, I paid my money and then I'm done.
Exactly.
You really want to invest in yourself.
Yeah, and if you're spending that much time recovering and paying the finances, like why wouldn't you want to optimize that result? Like, and we're all for it. So choose your plastic surgeon wisely.
What would be some of the reasons you would tell a patient why you shouldn't do a surgery right now?
I would say the most common reason why I tell my patients not to do it right now is because I get this sort of line of questioning. I really want to get my facelift done, but it's my anniversary in 3 weeks. Can I get it done right before?
Yeah.
Or I'm traveling to Europe in 3 weeks.
Yeah.
Is it okay if I get my surgery right beforehand? And I usually just tell my patients, if you have a big event, if you have something coming up and the timing isn't there to recover appropriately, delay the operation until after that event, because so many different things could happen that could end up affecting that event or your travel plans or your party or whatever it is, and you're going to end up ruining that. So if you got something and you don't have enough time, ideally 6 weeks to recover from a procedure, delay that procedure.
Yeah. And I mean, we're very careful about who we operate on, and we strive for perfection in every single case we do. But at the end of the day, medicine in general, including plastic surgery, is like an imperfect science. And even in the best of hands, complications are real and side effects happen. So give yourself plenty of time. Don't be stressed. I mean, the post-operative time while you're recovering is not a time you want to stress about your finances and am I going to make it on this trip? You want to just relax and let your body do the healing. So give yourself ample time, and if we get the sense that you're kind of being rushed or pushed, like you said, I wouldn't operate on them today or tomorrow.
Is there anything specific that you think a patient should prep for before a consultation?
I think patients should do their own research, and once they do their own research, either by themselves or if they've been to other consultations, I think by the time they come in to see me or Dr. Feldmar, the questions that they ask about the operations or procedures that they may need are on another level. And I feel like I'm helping them more at that point. So I think first and foremost, just kind of do your own research and do some introspection and see what I truly want. I don't like when I get asked, like, what do I need, doctor? Because it's not about me. At the end of the day, like, I want you to be happy. So you tell me what bothers you the most. And so introspection, and do some research, and then, of course, we're here to educate and inform you, but you kind of need a baseline.
I have 10 pictures. I want these boobs. How do we react to that?
Yeah, I mean, we want to try to reach what their goals are. And I think you said a very important point. You know, the more you're informed as a patient on what you're thinking about doing, even if you're going down the wrong direction, and even if you're using Google and it's giving you bad advice, at least you have something to talk about with your doctor and bring up and questions to ask. And that's going to make you more informed. It's going to make the whole consult a much higher level consultation, right? You know, inspiration photos are fine. It helps. Again, that meeting of the minds between the patient and the doctor, that you guys are both on the same page, is extremely important. And it does, I think, it helps me at least to see what is in their mind, what they're really looking for. Even if I can't reach it or they're not a good candidate for it, at least it's some basis that we could start on a conversation and get to an idea of what we could do.
Mm-hmm. And then I think for us too, although we're like a boutique kind of practice, but we still kind of have multiple layers. When a patient first calls our office, like you can talk to Marcy, and Marcy will most likely be the first point of contact too, and then you guys can form a relationship and then talk about what you feel like your issues are, and then from that point on, Marcy can kind of educate you, and that's just going to be that half an hour or hour time you spend with Dr. Feldmar, like so much more informative and meaningful and educational, in my opinion.
So I'm more important than you guys are.
I think so, yeah, well, we'll talk about it off screen.
How important is it that the patient is completely honest and transparent as far as their medical history and what surgeries they've gotten done.
I mean, we want our patients to be honest with us. It's a completely protected environment. You know, everything that happens in the consultation stays in the consultation. But it's important, you know, if you're leaving information out, if you're embarrassed by something, that may be an important piece of information that we need to know for your safety or to give you better results. So my advice is to just be honest. You know, we've heard everything. Nothing surprises us anymore.
Yeah.
So, yeah, don't be embarrassed to talk to your doctor, your plastic surgeon about, you know, what medications you're on, what's happened in your past, all that type of stuff.
Yeah, I wholeheartedly agree with that. Like, nothing good can come out from not being fully transparent and telling your surgeon everything. Because at least by then, we can plan for things, or if we do offer you an operation, but at the end of the day, it's all about safety too. We want optimal outcomes, but safety. So don't hide anything. I mean, it's not gonna go well.
Especially with nicotine.
Oh, yeah.
Patients that hide it, can you explain why it's so dangerous for them not to be honest, especially if we're very clear, we can tell the rules of when you want them to quit smoking and if they have to start smoking again, when they can resume that, and why it's so...
And it's not just smoking. It really is all nicotine products, you know, not just tobacco, but nicotine itself. So that then goes to all the things our patients are using to stop smoking. You know, nicotine patches, nicotine gum, or, you know, other vaping, all this type of stuff has that nicotine. And the reason why we don't want the nicotine is because it will affect your healing. It could affect how well you scar. It could affect the outcomes of the surgery. So something like that, it's just, there's no point. We're not telling your insurance company.
Right, no.
So be honest with us. Tell us if you're doing something like that. You know, other things that we see a lot is, you know, the PLG1s, the weight loss medication. Patients, some of them are embarrassed that they're on these weight loss medications, and that could affect your surgery. It's dangerous if you're taking that right up to surgery.
Right.
So we want to know to inform you to stop taking that, and then you can resume it after surgery. So yeah, it's very important to let us know, you know, what's going on.
Yeah.
Why is it dangerous for them to take the weight loss shot before surgery?
You know, the weight loss medications are pretty new. When they were first being used, we started to see people that were on these medications slow down digestion, so you have more food in your stomach. And typically, when you get surgery, we would say stop eating, you know, 8, 10, 12 hours before surgery, depending on what it is. But we're seeing now the people on PLG1s, food is lasting in the stomach much longer than those 12 hours. So really, we want you to stop at least 1 week before surgery, if not 2.
Yeah.
To make sure it's completely out of your system.
I think that recommendation is always kind of fluctuating because these GLP-1 medications are quite new. But I mean,
yeah, and it's going to probably change in 6 months down the line.
Right.
You know, as we get more information.
It's better safe than sorry. So at least for our practice, we have them stop.
We want them to stop the dose the week before they do it.
Yeah.
So they're off at least a week.
Because the last thing you want by hiding things from us is to have a hole in your face because you were smoking on the day of your facelift.
Right.
Or to get food going from your stomach into your lungs because you were actively on GLP-1s.
And
it's not worth it.
It extends to even things that you wouldn't even think are important. Like, you know, people, when we ask what medications you're taking, and they'll list their medications, but they'll leave out all the natural medicines that they're taking, all the alternative medicines that they're taking, thinking that, you know, these are just natural stuff and it's safe to take. But the reality is some of these medications are very potent and they have blood thinning effects.
Right.
And, you know, we could get into bleeding that we're not expected to because you're on these type of medications. So everything is, even if you don't think it's important, it may be important.
I agree.
I mean, when it comes to, obviously, we want our patients to let us know. We don't want you to be using drugs before surgery. That could be very dangerous.
Yeah.
Certain drugs could affect your heart, and that's very important during surgery that your heart is functioning normal. So yes, I would recommend stop doing all that as far as you can before surgery.
Yeah. And alcohol's in that category, or when do people, because I know I've had conversations with a few different doctors and everyone has a different opinion on when to stop or when you should stop drinking before surgery.
It depends because alcohol, I mean, like a lot of drugs fall under different kind of categories. So you want to stay away from like stimulants because
Right.
like Dr. Feldmar said, it can raise your blood pressure. So it can cause issues during the operation, but afterwards too. It can cause hematomas, it can increase your blood pressure, and you can
Cause
get ischemia. And so stay away from that. And alcohol, I mean, a lot of times operations are invasive procedures, so we prescribe pain medication
Right.
post-operatively. But if you're on kind of sedatives or other kind of alcohol that depresses your kind of like brain activity, I guess, it's not safe because it can stop your ability to breathe, and so.
And also, I mean, I see people that drink relatively soon before surgery, or they have their last drink, you know, within 24 hours, 48 hours. I see, you know, it thins the blood. I mean,
It
it's
does,
harder
yeah.
for them to clot. So that could become a real issue in surgery. You
Yeah.
know?
When you come in for a consultation to make it smoother, I think that if you have your questions written down, also if you have children, which most of our patients do, make sure that any transportation or any child care is also taken care of, because with certain surgeries, which I'll address to you, there's lifting restrictions, correct?
Correct, yeah. Well, I mean, I think it depends on which operation, but yes, a lot of times we may limit how much you can lift, sometimes to like 20 pounds. So, you know, if you have a young child and they're 40 pounds, it might not be a good idea to be picking them up and carrying them around after surgery. So,
Especially
you know,
with a tummy tuck or a breast
right.
surgery.
So like, you know, to pre-plan, to plan for how you're going to manage the recovery is important.
We touched on having child care and transportation afterwards, but also what's very important is that you have a plan in place and a really good support system. Why is having a good support system important for surgeries?
Well, I mean, I think it just depends on your family life, your personal life, what's going on at home. You know, surgeries can be a big deal, and it could take a lot out of you, and it could take a lot of time, and there may be discomfort involved and other things. So to have your family or your loved ones there supporting you is very helpful. To help people kind of take on some of the responsibilities during that initial recovery phase is helpful. I mean, you know, if you have someone that can help clean and cook and give yourself a break from doing stuff like that, it is good. Also, you know, with surgery, you know, a certain number of people have some depression after surgery.
Touch on that, yeah.
And it's very normal to have that, to kind of feel low and down while you're recovering. You have a lot of energies being expended on healing, and that could make you a little depressed. So it is very helpful to have those around you that are supporting what you're doing. They're not putting you down for having plastic surgery, because sometimes we do see that in family members. Really, just to have the right people around you will make your recovery much smoother.
On that note, like that thing about regret and depression after an operation, it's not only for cosmetic aesthetic plastic surgery. It goes into breast reconstruction surgery and so on and so forth. So it's just a real part that I don't think it's spoken about enough.
Yeah,
but
people really don't talk about it, but it's definitely a real thing.
It's
having
a roller
some
coaster.
depression after surgery is, and you're right, in any kind of, when I used to do general surgery, cancer surgery, all these type of surgeries, people, a good percentage of people do have depression.
Yeah.
I think it's important, especially with mental awareness and mental health being a big topic, that it is talked about and that it is brought up in the consult. So I think that's super important.
It's transient though. It's transient
Right.
depression, or because it's an emotional kind of roller coaster. So
I just think, and when you have some pain or discomfort, it makes you sad.
Yeah.
And you know, you're in a sense voluntarily going through this experience.
yeah.
So, you know, just being informed about it before surgery, I think helps a lot of people. Mm-hmm. Because knowing that what their experience is normal makes them feel better, and it actually makes it go away.
Agreed, and also part of my responsibility and my job as patient coordinator is to be the handholder, right? To explain to them while this is happening, to be able to talk to them. And I think a lot of what we do here, and because we also do a lot of reconstruction, and a lot of the patients we deal with have been traumatized from previous surgeries, not by us, that somebody? Am I ever going to ask the doctor, what if this, what if my drain pops out? What if there's all these questions? And I just want to assure everybody that, especially here in this practice, that I am available 24/7. I have access to the doctors 24/7. So, we try very hard here to make this a family atmosphere, and especially, during the consult, you said it earlier, Dr. Lee, that we want you to come here for the rest of your lives. We want you to bring your family
Right.
here. And, I think it's super important that they feel very comfortable with me, and, they might not disclose something to the doctor and then call me afterwards and say, hey, I didn't say this, but this is what's really going on, and then I can talk to one of you about it and then relate to them. So it's just a very, like you said before, it's a very safe atmosphere here. So throughout your journey, I will be your main contact. Like I said, I always have access to the doctors if there's any other questions, but I'm here through your initial visit for consult, through all your post-ops, I'm with you, all your aftercare, and all your questions, which I think is super important.
I think you do an excellent job with the patients. I mean, it's really nice for them to have somebody besides the surgeons that they could confide in and talk to and share. Because even, like you said, you could be totally honest with us and all that, but we understand that it's not always so easy to talk to the doctors.
Sure. Yeah.
But Marcy is a very easy person to talk to. Everyone loves talking to Marcy. So.
But I think it's super important to build a relationship with the patient as you would build a relationship with a friend, like really get to know each other, because again, you want them to be honest. I want them to feel safe. I want them to feel comfortable. I want them to come back. We were just talking about what questions patients should ask that they don't ask.
During a consultation.
During the consultation, yes, thank you, Dr. Feldmar. They don't ask who is doing the closing. They don't ask who is doing the suturing.
Well, I think the reason why a lot of patients don't ask that is because they expect that their surgeons are doing the whole case. And that necessarily is not the truth in the community.
Right.
The surgeon may be doing the critical portion of the operation or the majority of the operation, but they'll leave the skin closure to assistants. And that may be okay in a lot of situations, but there's no one that's going to sew better than your plastic surgeon. And if they're abdicating on that job, that is what you're going to see every single day, is that scar. And that's what all your friends are going to see and your loved ones are going to see. For us, I think it's very important that we're there and we're making sure that the results are what we want them to be.
Well, I just always think it's wild that, one of the first things they ask about are the scars, and then they don't ask who's doing it. So that's why
because I think it's that they don't realize that that's not necessarily the standard out in the community.
What I wish my patients asked is, they don't really ask how long the operation is going to take. And when I quote them an amount of time, they're always appalled. I feel like we take a little bit more time than what may be average. And that's because we actually spend a lot of time on the final stage, which is closure of the skin. A lot of times I feel like plastic surgeons and other kind of surgeons spend all of this energy and time just kind of doing stuff beneath the skin. But when it comes to skin closure, they almost just staple them up and whip stitch them. At the end of the day, in 10, 20 years time, you're not gonna boast to your friends, oh, my plastic surgeon took 2 hours to do my facelift. You're gonna boast about how the scar is almost invisible. So we take our time. I wish they asked, oh, how long does it take you to actually close the skin? Because Dr. Feldman and I feel like we take way longer than most surgeons to close skin.
Yeah, I mean, I think it's, again, the skin closure is a very important part of the operation. I mean, that's what you're seeing. So, we take just as much time closing the skin as we do doing the deep work. And I like to consider myself an efficient surgeon in the operating room, but I'm not a rush surgeon. I don't try to, get out to go play golf or something like that. Right. When I'm doing my operation, my sole focus is the operation, the patient, and the outcomes of the surgery. And I don't really care how long it takes, as long as I'm moving forward and things are being done the correct way.
Yeah.
And we're never going to charge a patient more money if, tell them, or we say, okay, the surgery is going to be, let's call it 6 hours, and then you decide during surgery that this needs a little more time and it's an extra hour and a half, I'm never charging the patient
No,
that extra
it's not
money
about nickel
because-
and diming, it's about
Right.
patient
Yeah.
safety.
Agreed. So, I
Yeah.
think that's a concern. Well, what if it goes over? And they told me at a different place that if it goes over, then, they charge me for that. And we don't do that here.
Yeah.
I want to be very clear about that.
Yeah.
It's a safety first, and if we feel that the case is going to take longer, not me, I'm not operating, the doctors are. But if they feel that it's going to take a little longer, we have that leeway here that, will make that happen. Also on bigger case days, i.e. a facelift, a neck lift, both of you, which I think is great, it's only that surgery that day. That's the only
Yeah.
thing you're focusing on. You're not seeing other patients that day, and I think, that is part of patient care as well, because you're concentrating on just one person that day.
Yeah, you hit a very important part. I think that's actually another question that I wish patients had asked too, because I know a lot of practices out there, they're very volume based, and you may be the 5th or 6th operation on that day. And to be honest with you, if it was my family member, I would not want my family member to be the 5th patient for that surgeon. For us, I mean, it depends, of course, on how big of a case it is, but we know our limits as far as like how many cases we can do in a day to give it 100%.
So, Marcy, after all this talk and going over all this stuff, if you could just summarize, what do you think is the most important thing for the patients to take away after the consultation?
Knowledge and trust. I think that the more educated that they are after this consultation or during the consultation, the more questions they ask, they know how to prepare for it better. And I think that I can't express enough on, go with the surgeon, and I always say that to people, go with the surgeon that you trust, go with the practice that you trust, because again, you're dealing with me, the patient coordinator or patient coordinator in any office, the most. I'm the person that's seeing you the most, I'm the person that's talking to you the most, so you want to go with someone that is reliable, honest, and trustworthy, because you want them to feel like family. You want what I'm saying to you that I would say to a relative or my best friend. If I'm telling you that you should go with this surgeon, I would also tell my best friend to go with you, as I have, both of you. So I think that's really important for me.
I agree. I mean, I think it's, education is very important, is extremely important. A lot of people come in with some preconceived notions. Hopefully they leave with a better understanding. If at least just to go home and read a little bit more, and maybe we could guide you in a better direction and you could go and learn more on your own, and then come back and ask us more questions, and just get as informed as possible. You're going to be happier with your overall results.
A lot of patients ask in the consult, and they ask you guys, and both of you direct it, talk to the boss. Financing. That's a question you would have with your patient coordinator, not your doctors. We do offer a lot of different avenues for financing and layaway plans here, but that's a question you have with me and not your doctor.
Yeah, and I get asked a lot about, how much is this going to cost? And I always tell them that's above my pay grade, and I literally don't know how much it is.
The doctors have no idea.
Right, so
really don't wanna
Marcy
know.
is your go-to. And we don't want to know, and that's important too, because it might be a little too much information, but within our practice, I mean, Dr. Feldmar and I, it's been carved out in a way that, like, what we truly do is just take care of patients and do the best job in the operating room we can. And we don't really focus on how much it's going to be and so on and so forth. It's like other people, so like Marcy's there, and don't ask us how much it is.
Yeah,
I don't know.
I don't want to know.
Yeah, I don't even want to know. Yeah.
Thank you, everyone. It was a pleasure talking to
Yeah, that was
Dr.
fun.
Lee and